So what would be really good now is if you could tell us a little bit about your placement experiences while you've been on the course.
Okay. So we've had lots of different placements already. We're due to go on our 5th placement. One that stands out for me is I got to work on intensive care at Walsall Manor Hospital. It was fantastic. They let you get really involved. It was obviously very intense with how poorly the patients were, but no matter what, I worked with my supervisor or my assessor, which we have on practice. I felt really comfortable working there. Had a lot of support. Unfortunately, if we lost patients, then I had the support after. But it was just a really good opportunity to learn all the new skills. We got to work with medications, got to learn a lot of the IV drugs, got to talk to all the families and the patients. It was just a really good experience.
So you'll find that with the placement allocation, you go to a range of different placements that you have to go to meet the NMC requirements for the course. So I've spent some time on a surgical ward as well as a general medical ward, and then sort of spending time in a variety of settings. So I've been in an acute hospital, but also in a community hospital, some rehab placements, and then going into community and intensive care for my next placements.
My placements differ a little bit from Nichaila and Tamzyn's, with them being adult nursing. So a lot of my placements are all mental health based. So I've done a placement on a psychiatric intensive care unit. I've done one on a mixed acute ward. I've worked with children with eating disorders, and then I've worked with elderly with dementia and community-based placement as well. So you get a really big variety of placements to go on. So if you go with a really open mind, you might find that there might be areas that you are really interested in, or something you've never considered working in before, which I found with my placements. And there's also those opportunities to have a lot of physical and mental health integrated. So where I worked for my dementia placement, I took opportunities to go onto the wards as well and do a lot more physical care. And then the same with the eating disorders and children's services. It was incorporating both, because you will learn both aspects on the course. Where you do specialise in one area, when you finish you will still always incorporate both physical and mental health during the course for your training.